Good afternoon. It's Dr. Hope once again. Today we are going to look at the descending aorta. Descending aorta. This anatomy. Today's date is 27/3/020. The descending aorta is a part of the aorta itself. The aorta has three parts, which is one of the great vessels that move blood away from the heart, from the left ventricle. The aorta has three parts, which is the ascending aorta, we have the arch of aorta, I will have the descending aorta. So, but for this lecture, our concentration will be on the descending aorta. The descending aorta has two parts. We have what we call the thoracic aorta. I will have the other part called the abdominal aorta. So this is the thoracic and this is the abdominal aorta. The thoracic aorta on its own part begins from level of T1 thoracic vertebrae and it moves slightly on the left side of the vertebral column before ultimately getting to the midline, and it exits from the thoracic region via the posterior mediastinum. It gets away from the thoracic region through the thoracic diaphragm, because the thoracic diaphragm actually separates the thoracic aorta from the abdominal aorta. That is, and the extent downwards of the thoracic aorta is from T1 to the level we call T12. So the whole of that region is the thoracic aorta, while the other part is the abdominal aorta. The thoracic aorta has two branches. It has what is called the parietal branch, It also has what is called the visceral branch. The parietal branch, there are two arteries that form the parietal branch. We have two arteries form the parietal branch, which is one. We have the intercostal arteries, I will have two. We have the first one called the intercostal arteries, and the second one is called the superior phrenic arteries. The superior phrenic arteries supply the superior aspect of the thoracic diaphragm. So aside the parietal branches, the thoracic aorta also has what is called the visceral branches. The visceral branches are 4 in number. There are 4 in number, We have one. We have the esophageal branch. Esophageal branch. We have two. The pericardial branch that goes to the pericardium, pericardial branch. We have three. The mediastinal branch. Mediastinal branch. I'll have four. We have the esophageal pericardial branch. We have the mediastinal branch. I will have the bronchial branch. Bronchial branch. So these are the four branches of the branches of the visceral aspect of the thoracic aorta. So we have, as I said before, we have two branches of the thoracic aorta, principal branches. We have the parietal branch and the visceral branch. The parietal branches are the intercostal arteries and the superior phrenic arteries. While the visceral branches are four, we have the esophageal branch, pericardial branch, mediastinal branch, and bronchial branch. Then we now move to what we call the abdominal aorta. We now move to the abdominal aorta. The abdominal aorta begins from the level of T12 and extends up to lumbar vertebrae 4. It starts from the T12 vertebrae and extends up to lumbar vertebrae 4. At lumbar vertebrae 4, it will split into two, and these two divisions will call it common iliac artery. So it depends. Like if I stay in anatomical position, this side is the right. This is the right common iliac, artery, while this side becomes the left common iliac. So look at the two landmarks, which is T12 and L4. So this abdominal aorta also has two main branches. It has the parietal branch. It also has the visceral branches. It has the parietal branch. It also has the visceral branch. Parietal and visceral. The visceral branches are referred to as being unpaired branches. So you have the first unpaired branch, which we'll call the celiac trunk. Called the celiac trunk. We have the second unpaired branch, which we'll call the superior mesenteric artery. I will have the third unpaired branch, which is called the inferior mesenteric artery. So these are the three arteries, or the three main branches of the visceral branch of the abdominal aorta. So they are unpaired, and they line on the anterior aspect of the abdominal aorta. So these arteries, I'll have to go on and tell you the further branching out of these principal arteries. These principal arteries, for information, supply the viscera, such as the liver, the gallbladder, the stomach, the pancreas, the duodenum, the small intestines, and the large intestines. So the three arteries here are the principal arteries that are responsible for that. So if you come to the celiac trunk, because of the name, the trunk, which is celiac trunk, celiac trunk, you have the three main divisions, which is one, you have the common hepatic artery, you have another branch which is called the left gastric artery, and you have another branch called the splenic artery. So these are the three principal arteries that will come out from the celiac trunk: common hepatic artery, left gastric artery, and the splenic artery, which is this. You have the common hepatic artery, you have 2, the left gastric artery, you have 3, the splenic artery. So while and this the distance from the celiac trunk to the superior mesenteric artery is 2.5 cm. So the superior mesenteric artery inferiorly separates from the celiac trunk at 2.5 cm, while the inferior mesenteric artery goes superior to the point of splitting of the abdominal aorta, and the length where this point is referred to as the terminal segment of the aorta. So this point, which is the terminal segment of the aorta to the inferior mesenteric artery, is 5 cm. So that is this. So now we'll look at the unpaired branches of the abdominal aorta. The unpaired branches of the abdominal aorta, they are 5 in number. We'll have the unpaired branches are, we have what is called the inferior, we have the inferior phrenic artery, we have the inferior phrenic artery, we have 2, the adrenal artery, we have 3, the renal artery, we have 4, the testicular artery, this okay, and we have 5, the lumbar artery. So the inferior phrenic artery supplies the inferior aspect of the thoracic diaphragm. I made mention earlier of the superior phrenic artery supplying the superior aspect of the thoracic diaphragm. Then you look at the adrenal arteries. The adrenal arteries supply the adrenal gland, and these adrenal arteries commence from the base, which is there on the posterior lateral aspect of the abdominal aorta. They commence from the base of the superior mesenteric artery. The renal arteries, they commence from a distance 2.5 cm inferior to the superior mesenteric artery, and the length of this renal artery is 7.5 cm. So they commence 2.5 cm below the superior mesenteric artery. Then that of the testicular artery commences between the superior mesenteric artery and the inferior mesenteric artery, halfway. That is where you see the testicular artery. Actually, the name testicular artery is for males, while the general name, both for males and females, is referred to as gonadal arteries. So for females, instead of you having testicular artery, you now have what is called ovarian arteries. Then the other group of arteries are the lumbar arteries, and they supply the posterior abdominal wall. Then we'll now we'll go back to the unpaired branches. We'll look at the superior mesenteric artery. The superior mesenteric artery gives blood supply to the small intestine, the whole of small intestine. It also gives what is called an anastomotic branch to the duodenum and the pancreas, which is called the pancreatico-duodenal artery. The superior mesenteric artery also supplies it supplies the small intestine. It also supplies majority of the large intestine by giving out a branch which is called the ileocolic artery. It also gives out what is called the right colic artery. It also gives out what is called the middle colic artery. The right colic artery, or even the ileocolic artery, supplies the ileum and that of the cecum, while the right colic artery supplies the ascending colon, and the middle colic artery supplies the transverse colon. The inferior mesenteric artery supplies the other parts of the large intestine by giving blood supply to the descending colon, which is called the right colic artery. It also gives supply to the sigmoid colon, which is called the sigmoid artery, and it also gives blood supply to the rectum, which is called the rectal arteries. I want you to note again that if you go up to the celiac trunk again, I've told you that it gives out 3 branches. It gives out what is called the left gastric artery. The left gastric artery supplies the lesser curvature of the stomach, one of the anastomotic branch of the stomach, while the common hepatic artery also splits into 3 or 2. It gives rise to what is called the artery to the liver, which is the hepatic artery proper. It gives out a branch to the gallbladder, which is called the cystic artery. I want to point out again that the left gastric artery, aside supplying the lesser curvature of the stomach, it also gives a small branch to the inferior portion of the esophagus. Then we now move to the splenic artery. The splenic artery supplies the spleen. It also supplies some part of the pancreas. The splenic artery also gives out what is called the left gastroepiploic artery. It gives out what is called left gastroepiploic artery. So, which runs on the greater curvature of the stomach. So, the part of the hepatic artery, which one goes to the liver proper, the other one goes to the gallbladder. There is a branch that is called the gastroduodenal artery. The gastroduodenal artery will further divide into what is called the right gastric artery. It also gives out another branch which is called the superior pancreatico-duodenal artery. This superior pancreatico-duodenal artery will have to anastomose with the branch that will come from the superior mesenteric artery that is called the inferior pancreatico-duodenal artery. The two of them will form an anastomosis at the head of pancreas, and they will supply both the second part of the duodenum and that of the pancreas. So, in addition to these unpaired branches, which is celiac trunk, superior mesenteric artery, inferior mesenteric artery, there is also one unpaired branch that runs down here, and that one unpaired branch is called the median. We call it the median sacral artery. So that makes the whole of these arteries to be 4: celiac trunk, superior mesenteric artery, inferior mesenteric artery, and medial sacral artery. They have now completed the unpaired branches, while the paired branches of the abdominal aorta, there are 5 of them: inferior phrenic, adrenal artery, renal artery, testicular artery, lumbar arteries. Then I guess there was a clearer understanding of the celiac trunk. If not, note that we have 3 main branches coming from the celiac trunk. You have the left gastric artery, you have the splenic artery, you have the common hepatic artery. I told that the common hepatic artery will give what is called the hepatic artery proper, which goes to the liver. You have the cystic artery, which goes to the gallbladder. I will have another branch which is called the gastroduodenal artery. The gastroduodenal artery will further give rise to what is called the right gastric artery, and it gives you what is called the superior pancreatico-duodenal artery. So far, that is the much I can tell you about the descending aorta, having 2 branches, having 2 parts, which is the thoracic aorta and the abdominal aorta. And I've given you all the branches coming from the thoracic aorta and all the branches of the abdominal aorta. Thank you so much for listening. Thank you.